Good morning, Loganites. It is Nurse Practitioner Week 20. You're going to go, wait, we missed a week. Yes, we did because it's been like really intense. So this week, I'm going to focus on talking about prescriptive authority, and that's kind of come up in the beginning of the semester and how that affects you as a nurse practitioner. So depending on your state as a nurse practitioner, you have a thing called prescriptive authority. And what that basically means is, do you need anyone else to be able to write prescriptions? So can you write a statin or a beta blocker for somebody without having to confer with another doctor? So here in Tennessee, you do have to have supervision with the physician. So you have to have a good working relationship. So what comes with that? It kind of limits what you can do as an advanced care provider. So why do we want nurse practitioners? We want nurse practitioners to be able to extend the arm of the hospital, to be able to fill the gap in the needs of the community. There's not enough doctors. We all know this. And a lot of doctors are going to specialties for more money. So what license can we put in place of a doctor that we can put in a community that can serve primary care? Nurse practitioners. So you've got these nurse practitioners that you're going to put in these communities, that you're going to say, hey, I want you to go educate, I want you to go take care of, I want you to monitor blood pressure, I want you to do all these things, look out for all of these other things, refer them to the specialties when we need to, so that the specialty doctors can make their money as well, but you still have to work with another physician. It's a limiting factor. It is a limiting factor. Why are we allowing our state representatives to not allow our nurse practitioners to be able to write some prescriptions? And I understand that, you have to have oversight and no one's above the law, right? But you don't want to limit the people that have gone to school to fill the role and then not let them actually do the whole role, right? It's just been an interesting thing that's come up in school because prescriptive authority is a good way to look at how does your state view nurse practitioners. How, in most states, you do need supervision from a physician. That's just what it is. But what makes a physician better than a nurse practitioner? Is it med school? Is it years of patient care? Is it... I don't know what it is, because as a nurse, I've been a paramedic for... let's say a practicing paramedic for 5 years, a practicing nurse for 3 years, and then by the time I get my MP, I'll have 5 and 5, right? So I'll have 10 years in healthcare before I get my license to actually do this stuff. The doctors I've met that are, get their degree and then go do their 4 years of med school and then have to do their residency, they're not that great. I'm going to be quite honest. They still have to learn all the stuff that you've had to learn by dealing with people, that good patient bedside manner. Oh my gosh. That's why doctors don't have good bedside manner, because they don't have to dig the trenches for years before they get the power to be the top dog. You know what I'm saying? So I guess what I'm getting at is this prescriptive authority came up this week in class, and it's been this big opener of what is a nurse practitioner's role and how do you feel about it? So if you're sitting out there and you're like, I want to be a nurse practitioner, or I am a nurse practitioner, or I'm a nurse practitioner school or nursing school or whatever, sit down and think about it. What is the role that you want your nurse practitioner to fill? Do I want a nurse practitioner in the hospital to extend the arm of the doctor? Yeah. That's a good spot that you can have oversight quickly. Because you've basically, in the hospital, your nurse practitioner is going to be the extension of the care provider. So like ICU, follow on the ICU, you've got 2 main ICU attendings. Residents and pharmacists and all this other kind of stuff. Those people swap out like a week on, week off for all the day shift. Well, night shift, you've got nurse practitioners. And they are the extension of that person. They've got protocols and everything they can do. And they can call if something wonky's happened. But they have direct oversight. That is acute care. That is crazy. Do you want them to have oversight? I do. Do you want your people out in the clinic to have oversight over simple blood pressure medication? I don't think so. I mean, I don't think so. I think it's kind of crazy. I think it's crazy to require, you do need some oversight, just like with anything. You need audits and whatnot, chart audits, and are you doing the right thing? Are you following the right protocols? Do you have patient complaints? Yada, yada, yada. Are you missing things? But it's a very restrictive thing. It is. Sorry, I've been thinking about this for a little bit, this soapbox of mine about prescriptive authority and what does it mean as a nurse practitioner, and since I'm taking that role, Because with that in the same statement, as I'm kind of going through this, I'm trying to transition in my brain what it's going to be from being the nurse to the advanced practice nurse. And you're like, it's not much different, right? It is. It is a lot. It is a lot because it's all on you. You have to change your view, like even just doing like a patient assessment. I've learned a patient assessment as an EMT, as a paramedic, as a nurse, and now as an advanced practice nurse, as a nurse practitioner, whatever you want to call it. I'm going to be a doctor. My wife hates when I'm going to be a doctor, Jennifer. But you learn the patient assessment, and just the patient assessment as the nurse practitioner is totally different. You have to ask all of these different questions. You go a lot further in depth into the patient assessment. Like a good example is like, as a paramedic, you arrive on scene, what's your chief complaint? As a paramedic, you will only ever do a focused patient exam. Ever. Even if you arrive on scene to a patient down, it's going to be ABCs, get them to the hospital. Stabilize, get them to the hospital. It's always focused problem assessment. As a nurse, I get maybe the same kind of thing. It's still the same kind of thing. You're really only focusing on a problem, even on especially in the ER, even on the floor, and in the clinic. So like, there's still a reason why they're coming in. You have to ask these certain questions. If you're collecting a past medical history, there's usually a form that you're filling out, and it's more, I don't want to say structured, because the nurse practitioner part is structured as well, but it's just more focused. However, when you get to the nurse practitioner level, now I'm realizing that it is more open, and it is more almost holistic is the way they're teaching it, because it's guided, but also you're focusing on the relationship between you and the patient. As the nurse, I've always felt like it's more item driven or like task driven. Like, yes, I need to assess the patient and plan for the patient, but I'm not diagnosing. You know, I'm thinking what the diagnosis might be. That's why you have all the nursing diagnoses in that book. You know, like when you're nursing school, it's like heart failure related to blah, 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 as evidenced by blah, blah, blah. It's nursing diagnosis because you can't diagnose as a physician or as a advanced care practitioner. So it's different in that fact because you had to learn all of the nursing diagnosis stuff and how to think as a nurse. Well, now you're learning it as a provider, and that it changes the relationship between you and the patient. And I can totally see why these like new physicians or like these physician assistants or these brand new nurses that go straight through nurse practitioner school that don't have like a lot of bedside experience come off the way they do. Because it's like giving you like you have the power and the authority to do this. This is your job and you have to do it. That's a lot. That's a lot of power. So that's my 2 cents on prescriptive authority, guys. Let me tell you what's been going on. So school's been rough. You know, you saw me 2 weeks ago with my wife. It has really, really ramped up. I'm technically behind because I'm still behind on reading in my pharmacology class. It's like 10 chapters a week, like legitimately 10 textbook chapters. Got a lot of projects, a lot of tests, a lot of projects, like 3 or 4 projects. I'm currently in a group project like message board right now. I don't know why. I don't know why the semester is more, but it is. It's a lot rougher. And then I got to do my checkoffs. I've got like 10, 12 days over this next few months that I have to do checkoffs on top of all of the homework and on top of work and family and everything else. There's a guy that I take care of at my clinic. So, you know, I'm a dialysis nurse currently. And me and him, he's in school. He's like, I don't know, mid-40s. He's in school again. He's going to get his master's in engineering. And we talk about it. And I was like, man, how's your school doing? He's like, God, this sucks. He's like, he's having to like redo the air conditioning and heating on the U of M buildings as a project. And like, what would make it feasible to redo this system? That's his project. We keep talking about how you got to have time for family. You got to have time for school. You got to have time for work, but then you also got to have time for yourself. There actually has to be time for yourself. You can't just be going and going and going all the time. And that's kind of like what this is right now. This is my time. I mean, it's honestly, it is Tuesday at 3:30, and the reason why this is my time is because my wife and stepson are busy. So, this is my time. I need to go work out. Oh man, I've been weight training, guys. Let's see if it looks good on the camera. A little bit. You can't really see it. That's okay. You don't have to see it right now. My goal is to be able to deadlift. My first goal is to deadlift my body weight. My second goal, I'm going to deadlift 2 of me, so double my body weight. I'm about 2 weeks away from deadlifting this body. I've been drinking less. I've been eating better. Lifting the weights. Got 2 months on that. I'm just trying to be better, guys. I'm trying to be the role model that a provider should be. Because I don't want to go to a fat doctor. If I see a fat doctor, I'm like, dude, what are you doing? You know better than that. And I know better as well. I think we all know better, but we got to hold ourselves accountable. And that's what I'm starting to do. That's what I got. That is me in a nutshell right now. That is me in a nutshell. I'm trying to take it one day at a time. So, guys, please like and subscribe. Watch my other videos. See what's up. Oh, comment if you want to hear anything different. If you have any questions about what's going on in school. Or what it's like to be a dialysis nurse or a peds trauma nurse or a medic or stepdad, I don't know. I got time. I like to make one of these videos a week, and I'll be here every week. So, remember guys, always keep your corn on the cob.